30 seconds.
Sure, sure. I'll just sit here, sister. I'll just sit here, sister. Assalamu alaikum. So, English is going to be my primary language, but if you don't understand, I can speak Urdu. But if we need a translator, somebody would have to translate it in Arabic. So, okay, thank you. So, we are going to be talking about diabetes. It's actually one of the most prevalent chronic medical condition in United States, and it is expected to affect over more than 50% of the population over the next few years. So it's a very, very prevalent condition. I have tried to keep it very simple, but if you have any technical questions, you want to go to detail at the very end, I will open up for questions. So one of the most important, I would say, information or question that I get from my patients is that what is diabetes and why it happens? I mean, why does it happen and why it happens more so in one type of population than the other? So it is a condition where the blood glucose is too high in your body for your body to handle it. Now, why the blood sugar goes too high? It is high because maybe the insulin, which is responsible for processing the glucose in the body, is deficient, or maybe it is there, it is not working, or even if it is there, you have too much demand that your body can cope up with it. So there are different conditions that can cause diabetes to happen. There can be different illnesses that can cause diabetes to happen. There is genetic predisposition, like it runs in the families, it can happen. And it can also happen in a condition which is known as obesity, where the weight is more than the body can handle, and that's why the insulin that the body is producing is little in proportion to the surface area that it has to serve. It's like similar concept that if you are prepared to attend 10 guests and now you get 35, so what are you going to do? They're going to overflow. So it's the same concept, okay? Um, Now, diabetes, there's way more classification than what I'm putting here, but this is the most simplest ones that I thought you all should be aware of. One is type 1 diabetes. This is the type of diabetes that predominantly happen in young children. And it is the type of diabetes where the body lacks the capability to produce insulin right from childhood or birth. So that is the type 1 diabetes. It can happen in adults, but it's kind of rare. It's mostly happens in children or very young, I would say kids. It can get undiagnosed and then can result in sudden type of admission or emergency room visits. But these days, if you are able to take your child to a well check visit, the doctors usually check the blood sugar, and that way it can be picked up early. And then the type 2 diabetes is the type where I was sharing with you is the most common type. There is insulin in the body, but it's little for what is required. The demand is way more than the supply of the insulin, and then this disproportionate amount results in too much blood sugar in the body and can cause various complications. Special type of diabetes is gestational diabetes or gestational diabetes. It occurs in pregnancy. It is a risk factor for diabetes in the years when the baby is born, and obviously can be helped and prevented. Now, the last three types, one of the types you may see is pre-diabetes. Now, pre-diabetes is a term that has been coined over the last few years, and this is an attempt to identify people who are just about to become diabetic. And the concept is that if we are able to pick these individuals who are just about to become diabetic, we may be able to intervene and prevent them from having complications and ultimately requiring multiple medications for diabetes. So the pre-diabetes is now becoming more and more of a condition than it was in the past, and actually it's treated very thoroughly. So that's one of the conditions I want everybody to be aware of it. It's very prevalent, especially South Asian, Middle East, very common. Now, why does it matter? I mean, why we are here, why we are talking about it, and why you all are giving your precious time. And the reason is that this is one of those conditions which is known as silent killer. By the time, if you're not going to a doctor's office, if you're not really watching what you're eating, and you don't have a means to figure out where your body's metabolism is, it just appears, and it can affect heart, kidneys, eyes, nerves, feet, genital organs, everything is involved. And unfortunately, if it is not controlled, can cause things like ending of dialysis, cardiovascular disease like heart attack, strokes, amputations, and loss of vision. So, I mean, I cannot tell you how much important it is. I have few patients who lost their vision because of diabetes, and it's unfortunate condition that the patients are just not willing to help themselves when they had time. So that's an important thing to consider. But obviously, if you can control it better, you can prevent it. And that's the beauty of it. I mean, this is one of those conditions that honestly can be prevented. And that's why there is a lot of emphasis on screening for diabetes. So whenever you all see your doctors, make sure that you talk to your primary care provider to screen you for diabetes. I will talk about it. It's very simple. And if you are picked up really early, as I said, even if pre-diabetic range, and you start working on it, you can prevent diabetes from happening. So it's pretty preventable. Scary, but preventable. So what are the common conditions? As I said, some people have no symptoms. It just appears on you in the form of an acute illness that results in major hospital admission, and then it is diabetes. So but most common, it is increased thirst, which is out of the proportion to the regular requirement. So it's a kind of thirst that just doesn't get quenched with drinking water. No matter how much water you drink, you feel like you're thirsty, and a lot of urination, because the sugar has to go out from the body. So this is a natural way of getting rid of sugar is in urine. And with that comes the thirst, and thirst results in water intake, and then it results. So it's a vicious cycle. People who have uncontrolled diabetes can also present in the form of muscle wasting. It's a lot of major amount of weight loss. We call it as cachexia in medical terms, but basically it means that your body or I mean, whoever have diabetes, their body is breaking each and every muscle in order to deliver more glucose to the system. So body get confused in uncontrolled diabetes. They just don't know how to handle, and then there is like this vicious cycle of too much glucose, less insulin, more glucose, less insulin, and the system just keeps on going until it causes end organ damage like the heart and lung, kidneys, and the brain. So, but these are the symptoms that usually indicates that there's an acute I would say, high sugar, or there's a massive amount of sugar running around because it's thirst, urination, fatigue, blurry vision because the glucose can actually go into the lens and it can attract water and the lens swell up. And then there's extreme blurry vision. So that's another one. And last but not the least, slow wound healing. So wound healing is delayed in uncontrolled diabetes. Is because you need blood supply, you need nutrients, and you do not need that amount of sugar to be going into any area of infection because it's going to brew and it's going to make it worse. So how it is diagnosed? It's basically just a blood test, very simple. It can be a fasting sugar. Your doctor will tell you not to eat anything for 10 to 12 hours and do the labs in the morning. It can be an HbA1c, which is a 3 months aggregate, which means how somebody is doing good or bad over the last 3 months. And the last one is the oral glucose tolerance test that we usually do in patients who are pregnant, and they can actually pick up the patients early and treat them accordingly. There are different reasons why the HbA1c can be up and down and may not be diabetes, but I don't want to go into that details because it can cause confusion. But your doctors should be educated enough to identify. But this is what you need is just simple testing, blood work. Now, what are the goals? So, people who already have diabetes, say the normal usually in the morning. In fasting, if somebody do not have diabetes, we like to see the sugars between 70 and 100. That's normal. If you have blood sugar, which is the morning one becoming more than 100 and it is coming less than 127, it's actually pre-diabetes. So, pre-diabetes, the sugars are a little more than 100 and they are less than 130. That's a simple way to remember. But once it is more than 130 in the morning, then we definitely know that a person has diabetes. And if you want to know the exact number, it is 127. So if it's more than that, that is full-blown diabetes. But if somebody is on medications, these are the numbers that we are getting diet or lifestyle. These are the numbers that we look for. Fasting between 80 to 130 after meals, 180 or less. And then the HbA1c goals are different for different people. But I would say on average, we would like to see it less than 7%. So those are like simple goals. But as I said, it may vary. If we have people who have a lot of multiple complications, and we can tweak the goal. And if I have somebody who's really active, athletic, we can make it even more tight. But this is the average. So this is my favorite slide, and actually I gave it to all of you as well. The reason is that because this is actually from ADA, and what they recommend is that if you are having and eating a balanced meal, this can pretty much help to regulate the blood sugar and improve the blood sugar. Actually, honestly, we all should be eating like this, but it becomes a prevention in people who do not have diabetes and becomes a treatment in people who do have diabetes. So this is the correct way of eating anyways, but it is extremely helpful to control sugars in patients with diabetes. You can divide your plate into three, as you may see. The big section, the green one, is your non-starchy vegetables. When I say non-starchy, I don't mean potatoes. I don't mean your yams or roots that grow under the ground. So those will come under your non-starchy vegetables. It's basically your greens, your beans, not beans, peas, and things like broccoli, cabbage, eggplant, okra, and all those things. That will actually be non-starchy vegetable. Then the other two, the one that's a fish, it's actually protein food. So protein foods can be obtained both from meat and non-meat. A very common, I would say, misconception is that whenever we ask somebody to eat proteins, they eat meat, lamb, and then that is like steaks and deep fries and what have you. It increases the saturated fat. So when it says protein, it basically means you can have chicken, you can have fish. Definitely, you can have meat here and there, but it should be more like lean meat, not saturated fat containing meat, because that is actually a disaster. And we also mean things like that come from plants. For example, you can have tofu, which is very prevalent here. You can also have things like very common chana, chola, or chickpeas. You can have beans, all kind of beans. You can have all type of lentils. They all are proteins. They're nothing but proteins, and they do not have any added sugar. So that's actually a very good source of proteins, to be honest. And if I have to come up with a meal plan for our culture, I would say you can have half of it salad, half of it vegetable curry. This can be your brown rice, not white, and this can be your any kind of chicken, fish, or maybe a lean meat. So you can very easily do it in our culture. You know, it's not like we cannot do it, but the concept is to keep the portion size. It's not a big plate, it's a sizable plate, and then make sure that the most of it is veggies in whatever you like, cooked, uncooked, raw, whatever, and the other two portions are equally divided into proteins and carbohydrates. So that is basically the concept. Okay, now you may not see dairy here. The third classification that came out allowed a portion of dairy, but dairy actually has both carbohydrates and proteins. So you can use your dairy in your protein foods, like your yogurt can come in protein foods. 1 cup of yogurt has 7 grams of proteins, and your egg can also come in protein. So you can kind of substitute those based on this diagram. Now, this is again one of my very favorite slides. The reason is that because if you see, I mean, honestly, my med school never taught me how to read labels. So this is something that you can learn it with practice and looking into it. But these are the commercially available labels. So whenever you look at any label, the very first thing you have to see is the serving size, the blue, the light blue one. What is the serving size of whatever you are consuming? Because if you think it is 230, the 230, you would think, okay, the whole bag of chips is 230, for example, but it's not the whole bag, it's one serving. So say that one serving is 2/3 of a cup. Okay, so that 2/3 of a cup are your calories. Now, why am I talking about calories? Because in patients with diabetes, we recommend, if possible, keep your calories between 15 to 1800. So if you are able to look into it, you will be able to understand your math. So that is just a rough way of knowing your calories. But the other thing that is important for you is how much percentage you have in your added sugar, this one, and then how much percentage you have with your saturated fat. So this is important because I put a rule of 5 to 10, and that is because if you have a food item where the saturated fat is less than 5%, that is awesome. I mean, that is your food. If it is less than 10%, I'll deal with it. If it is more than 10%, put it on the ground and step on it because that's not for you. So that is very simple, I can say, okay? The same goes with added sugar. Now, why I'm saying added sugar is important? Because your banana is 27 grams of carbs. You would say, wow, 27 grams, but that is not added sugar. So that is actually a natural source of sugar. So this is the difference. So I would say, I do tell to my diabetes patients that if you're having a craving, it's better to have a fruit than to have a cookies, candies, pasta, and whatever else is available there, which is just you don't know, or making halwa or other things that tons of sugar in it. Having a date perhaps is better than having any kind of ultra processed foods like Dunkin' Donuts and things like that. That's one. Second, if you do have a desire to eat natural sugar, like say you want to eat a banana, if you don't want your sugar to spike, you will have to eat it with a protein. You will not eat it the first thing, it is going to be the last thing. And the reason why I'm saying is because proteins and good fat, both of them, reduces the absorption of sugar into your bloodstream. So it's not going to immediately go and have an insulin spike and then you're going to go down. It is going to go in your body and then it will do its job. So remember, even if you're having natural sugar, do not eat it alone. It has to be with a protein source and a good fat source. Now, what is good fat? Your avocado is a good fat. Okay, that's a brilliant example. Your nuts are good fat. So you can use good fat to absorb the sweet, natural sweet products. That would be more good for blood sugar levels. Now, the other important thing is dietary fiber. So there was a latest we have this information gathering, we call them as studies, that basically showed that fiber is the most important deficient nutrient in Americans, is the fiber. And interestingly, if you are able to keep up with your fiber, you are going to not only control the diabetes, it controls the weight and it helps with the metabolism overall. Now, the question is that where you can get your fiber from. Again, I'm going to circle back to your beans, your lentils. Very common thing is psyllium. Escargot husk is extremely common around here. That is fiber. Your chia seeds, flax seeds, your pumpkin seeds, all that is fiber. So if you go up on the fiber, you are going to control your blood sugar. So, and again, just an example of a sweet snack. You take your date, you put your nuts into it, and you put sesame seeds on it. It's a very good dessert. It has sweetness, it has your nuts, and then it also will be not immediately processed in your body. So it takes time. Now, last but not the least is the proteins. Having good proteins in your life is extremely important, especially as we age. Just a simple math, I can just give you a special trick. Like everybody who do not have any kidney problem should have 1 gram per kilogram of proteins. You guys can calculate your own. If you do not have any kidney problems. If you do have any kidney problems, it would be 0.8 times the body weight in kilograms. So that will actually help because, again, for diabetes, you have to build muscle, you have to walk, you have to move. It helps with control of diabetes and blood sugar. Okay. So it brings me to the physical activity. So the more you do physical activity, the better you are going to feel, not only mentally, physically, but you will also improve your diabetes. This is a recommendation by American Sports Academy and WHO that at ADA and American Cardiology Association, everybody at least wants 150 minutes per week of physical activity. Now I'm calling it physical activity because physical activity is classified into two. One is exercise, and one is everything else that is not exercise. So this is collectively, it has to be 150 minutes. It does help with control of blood sugar. In this, I did not mention, but people who do strength training is good for them as well.
No question. 150
at the end.
150 minutes per week, but how much per day is it?
So you can do 30 minutes every other day.
Every other day?
30 minutes every other day, or however you like it. I mean, but we recommend going no more than the whole 150 minutes at the same time, because anybody who has not done any exercise and is starting new, it's a good idea to start slow. I can tell you a lot of my patients, the way I start is that I send them to physical therapy. That's like the very most of us have honestly some joint or other joint hurting. So if start from physical therapy, it gives you a jump start. And after that, then you can add small things like if you're going for a physical therapy, instead of parking close to the place, you can park away. Maybe you can park in another line, and then you add little by little activity into that. The 150 is ideal. I'm not saying that everybody should now start running today and make it 150 because it takes time to build yourself up. But eventual goal is that you should be at a pace that when you talk, you are huffing and puffing. That is the goal. If you are talking and you're not actually huffing and puffing, this means the speed is good, the cardiovascular endurance is good. So that's what it is. Okay. And then it can be anything, it can be walking, it can be swimming, it can be stepper, it can be cycling, it can be elliptical, whatever you like. It doesn't talk about strength training. Strength training, whoever is doing, especially for my young boys, if you do strength training, it's basically 30 minutes. Twice you have to do it throughout the week, that is minimum. And it should involve all major body parts. So like you can do reps, but like you can have an arms day, you can have a core day, then you can have a leg day. So you have to kind of touch every part. But say somebody hates gym, doesn't want to do it. Very simple thing is gardening. Gardening uses almost every muscle in the body. That is like another example, important way. So you can do it anyways, but move. The more you move, the better the diabetes is going to be, the better the health is going to be. So medications comes in different forms now. There are oral pills, then there are non-insulin injections, the GLP-1s that are out there these days. Then there are insulin pens, insulin vials that can be taken Some of them once a week, some of them once daily, and then some of them even with each meal. So there are different of them. And now for type 1 diabetes are the insulin pump, but some of my type 2 diabetes patients are also requiring insulin pump. And the reason is that, it's just body is a strange, I would say, God has made it very differently. As the time goes by, body's own capability to produce insulin can go down with aging as well. This is something that is new out there that we have seen, that patients who were not needing any insulin now need insulin. And that is because whatever stores they have, they burn out as they age. So some of my patients do end up on insulin pumps at a later age, or on insulin at a later age when they were not at a young age. But please, the important thing is to take your medications as prescribed. That's very important. How to check your blood sugars and why to check your blood sugars. These days, we have different ways of checking the blood sugars. One of them is known as continuous glucose monitoring system, where there's a sensor that go in the body and it's directly linked to the mobile. You can just touch it, or you don't even need to touch it. It directly communicates and give the blood sugars. The second one is actually pricking, which is the most common one and the most convenient one. People who are not on insulin just need to check it once in the morning in fasting, which is not eating after the dinner. And people who are on insulin should be checking their blood sugars multiple times a day, preferably 2 hours after a meal or just before the meal. And the reason why I'm saying is because we need to gauge how much insulin requirement is there with meals, and these are the two different methods with which we can do. And you can adjust the food items accordingly. Like if the sugars are spiking, I told you after you eat, if you did it in 2 hours and now it's 250, you're like, what did I have? You go back and see what you have, and next time either you cut the portion in half or maybe eliminate what you had and replace it with something else. Always replace the food items. Don't have that mindset of, I have to give this up. Because if you have that mindset that, I have to give this up, it's never going to work. The mindset should be what I can take instead that is going to be benefit for me. So you will not have that feeling that you have to dump everything that you like and life is miserable and I cannot do it anymore or whatever. So it's a good idea to think about replacements. We call them as meal replacements. The better the replacements are, the better you would do. And with that, you will prevent complications. Make sure you write your blood sugars. There are different ways of doing it. You can do it on a paper. You can do it in an Excel sheet. You can put it on your calendar. Whatever ways work for you. Low blood sugar is a real thing, can happen. So it's important. Low sugar is basically defined when blood sugars are less than 60, and or if somebody is symptomatic with blood sugar, even if it is not lower than 60. People whose blood sugar has been uncontrolled for a very long time, they can become shaky, dizzy, and sweaty, even at a blood sugar of 70 and 80. And if that has to happen, we have to treat them. This sometimes happens if the doctor is trying to immediately fix the blood sugar and now body doesn't have time to adjust to it. They will become symptomatic, although the blood sugars may not be less than 60. But ideally, when it's less than 60, somebody can become shaky, sweaty, dizzy, confusion. It's a good idea to immediately treat it. You can have 15 grams of juice, depend upon if you have a regular sugar containing juice. It's about half a cup. Some doctors are giving glucose tablets that are actually ideal. That will also help. And check the sugar again in 15 minutes. And if your sugars are still low, and you cannot reach your doctor, just go to the emergency room because there may be something else going on that is keeping the sugar down. So that is another. And same is for the high sugar. If the sugars are high, say your meter is saying sugars are high, cannot read, I would encourage you to call your doctor immediately. Make sure you have taken your medications appropriately. Do not repeat your insulin unless you talk to your doctor. And if with the doctor's recommendations the sugars are still not coming down, then just go to the emergency room, because there are two big complications that can happen from very high sugar, one of which is known as diabetic ketoacidosis, where the body has a lot of acid, produce too much acidity. You can call it like acid sickness. The cells are starving and can cause kidney damage and what have you. So please talk to your doctors about it. Again, these are the things that I would recommend everybody to do. One is regular doctor visits, eye exams, once a year at least. Foot checks, check your feet. I know we do wazoo all the time, but you have to check in between the areas of your toes, and also you have to see the sole of the feet all around. And that is important because these are the areas where you can have ulcers. and those ulcers can become, non-healing ulcers, and God forbid, can end up in amputation. So look at your feet, not just pretend that you're looking at your feet, just stare at them. So please, that's important. And for ladies, if you think you're busy, you cannot do it, so when you're about to sleep, maybe you can apply some moisturizer or lotion, because thickness in the bottom of the sole of the feet is the number one cause for cracks and infections. And that is when you can actually inspect your feet, make sure you don't have cracks, you don't have bloods, make sure there are no pins and things hanging around that you can step on it and can cause damage. So these things are important. Blood pressure, cholesterol medication, we will come back and talk about these conditions later on in detail, but make sure that those are also controlled. I mean, I don't think so anyone of us is a smoker, but then no smoking and no alcohol and no drugs. So these are take-home points. One is that obviously take your medications if prescribed. If you are one of those who have history of pre-diabetes or diabetes and are not on no medications, that's perfectly fine. You can try to do things like exercise and monitor your sugars, manage your stress. I can tell you that how many times the big things that actually result in blood sugar improvement is stress, sleep, and social connection. So what we are doing right now is an example of social connection. And this research has shown that it actually helps improve the body's cortisol. And with the cortisol, the diabetes improves. So social connection is very important wherever you have a time. Go out, talk to your kids, grandkids. Even if you're able to do like a video call, whatever, improve your social connectivity because it helps a lot. And sleeping is, I know a lot of us, we wake up for tahajjud and we don't go back to sleep. So I would say it is okay to sleep, and it is sunnah to sleep in the afternoon. So this is a beautiful time for you to utilize that sunnah and perhaps sleep in the afternoon to catch up on your sleep hours. And masjid is a great example of social connection, and this is like in our heritage, right, from the very beginning. So this is important, right? Holy Prophet, peace be upon him, used to be very careful. I remember that there are various hadiths about tapping on somebody's stomach and say, where is your belly going? So there is a lot to do with healthy eating in our religion, so it's a good idea for us to think about it. One of the ways I manage my stress is by reading Quran. So this actually helps a lot to manage your stress. So make friends with Quran as much as you can. Read it, say goodbye to it, make friends with it, allow it to read you, because that is the only way your stress will be under control. So with that, thank you. Any questions? Okay. What's your question, baby?
What are the most common times that you have diabetes?
Oh, very good question. So if it's type 1 diabetes, it can happen right at a very young age. Like a baby can be born with it, but they usually show themselves at around between 5 to 6 years of age. But in a grown-up people, if a grown-up lady is expecting a baby, can become diabetic as well. So it depends upon what is the age that they are doing. And then most of the people that develop is between 25 to 65 is most of the people, they do develop diabetes. So good question.
We have a Buddha.